good morning to all of you. I, Dr. Robin Chopra, Assistant Professor in Department of Physiotherapy at RPIIT Institute of Medical Sciences, Village Bastada, Karnal. I welcome you all in our YouTube channel, that is RPIIT Academics. But before watching, please don't forget to like, subscribe, share and hit the bell icon. So let's start the topic. So we are continuing our topic, that is fractures according to the path of the fracture line. We have four types of fractures, that is first is transverse fracture. As you see in the picture, it is a fracture in which the fracture line is perpendicular to the long axis of the bone. Second is oblique fracture. As in this fracture, the fracture line is at oblique angle to the long axis of the bone. So third type of fracture is spiral fracture. It is a severe form of oblique fracture in which the fracture plane rotates along the long axis of the bone, and these fractures occurs secondary to rotational force as you see in the picture. Then the last fracture is longitudinal fracture. It is a fracture in which the fracture line runs nearly parallel to the long axis of the bone, and a longitudinal fracture can be considered as a long oblique fracture. Then coming to the next topic, that is classification of fractures, anatomical classification of the fractures. First fracture is comminuted fracture, in which the bone is broken into more than two fragments. The second one is stellate fracture, and this fractures occurs in the flat bones of the skull and in the patella, where the fracture lines runs in various directions from one point, as you see in the picture. Next is impact fracture. This fracture where a vertical force drives the distal fragment of the fracture into the proximal fragment. As you see in the picture, the next fracture is depressed fracture. This fracture occurs in the skull where a segment of bone gets depressed into the cranium. Then next is avulsion fracture. This is one where a chip of bone is avulsed by the sudden and unexpected contraction of a powerful muscle from its point of insertion. For example, the supraspinatus muscle or one of the muscle of rotator cuff. The supraspinatus muscle avulsing the greater tuberosity of the humerus, and avulsion fracture of the tibial tuberosity. So here comes the summary of different types of fractures. Starting from first, that is simple, in which there is a little or no bone displacement. Then second is compound fracture, where the fracture ruptures the skin and bone protrudes. Then third is green stick fracture. It occurs mostly in children whose bones have not been calcified or hardened. Then fourth is transverse fracture, and this cracks perpendicular to the long axis of the bone, that is which may cause the displacement. Then fifth is oblique, where a diagonal crack across the long axis of the bone occurs. Then sixth is spiral and comminuted. Spiral, in which a diagonal cracking involves a twisting of the bone about the longitudinal axis, resulting in a crushing fractures or a more common in elderly. Then seventh is impacted fracture, in which one end of the bone is driven up into the other. Then the eighth one is depressed, in which the broken bone is pressed inward, that is mainly occur in the skulls. And the last one is avulsion fracture, in which the fragment of bone is pulled away by some tendons or muscular ligaments. So guys, hope so you all understand very well, and for more information please stay tuned, stay healthy, happy. Till then, take care, goodbye, farewell, and don't forget to subscribe this channel.